This is a case of chronic patellar tendinosis of 3 to 4 years duration. Conflicts of interest: I have stock in Sonics Health, and I'm a co-editor of a textbook on MSK ultrasound. Our patient is a 46-year-old former MMA fighter who has pain and tenderness at the inferior pole of the patella of some 3 to 4 years duration. Previous treatment has all been non-operative. He has pain on the stairs and again is tender at that inferior pole. Here is a diagnostic ultrasound of the area of most involvement, or most severe involvement. You see the patellar tendon in long axis, and on the left is the patella. See that the upper end of the tendon is hypoechoic, especially the posterior half, and it is thicker. And we can even see a calcification there. In this view, our patient is the upper left, and on the Doppler view, we can see that there really isn't much in the way of vascular invasion. In the lower right is a comparison patient of only 3 months duration who is much more acute and has much more vascularity in that deeper portion of the patellar tendon. Here's a long axis view. On the upper left is the area of the tenderness and the calcification and the dilatation. In the lower right-hand corner is the lower portion of the tendon in its normal region. Here is an amplified view, and we are injecting local, doing a hydrodissection in the tendon sheath, so that we can create an area of numbness where we're going to do our injection. In this view, we are doing a needling through our area of anesthesia and injecting a cc or 2 of PRP to stimulate the healing. At 5 months follow-up, the tendon shows some improvement. It is a little bit more echogenic, but this may be just an arrangement or a resetting of the ultrasound machine. Here's again the tendon in the short axis, and there still is an area of decreased echogenicity, although it seems to be improved. But the patient's pain is only about 10% improved. Here again, we're doing the hydrodissection at the upper level of the tendon on its superficial side. And here on the deep surface, as some of these injections can be quite painful, particularly when one is touching the bone. And we did a little hydrodissection a little lower where our needle will enter the tendon in its long axis. Here's the needle going into the area where we want to heal, and we are doing another biologic injection. And this is a fluid with a very low viscosity, and we are meeting some resistance in trying to inject it. So perhaps he is more healed than he appears on ultrasound or in terms of his symptoms. He says he has had only about 10% relief of pain. Here we are checking our needle position to see if we're still in the area that is most affected on its ultrasound view. So the question is, can we assess the degree of healing with ultrasound? And perhaps on this patient, we should have waited a little longer before doing a re-injection. Is pain at 5 months an indication of failure of PRP? Thank you very much for viewing. For more musculoskeletal ultrasound, the QR code in the lower right-hand side of the screen will take you to Amazon, where the textbook is for sale.